When there is something that's had as much attention as coronavirus, is there an element of trepidation when it starts coming into the hospital?
Yeah, absolutely. What we are seeing in the media and what we're seeing in happening all over the world, you are anxious about it. Are we going to be able to cope with the large numbers and be able to cope with the condition itself and the patients that have it? So there is a degree of trepidation, but so far we've been well prepared and ready for what's comes through.
When patients reach that acute level of coronavirus, just take us through their symptoms and what it's like to be treating someone like that.
Treating someone with coronavirus or COVID-19 is different to treating normal patients, and that's mainly because they are behind closed doors, they're isolated, so you don't get that frequent monitoring or that close-up care or response that you would normally do when you're looking after a patient. So we have to change our care to try and avoid how many times you're going into the room, not avoid, to minimise how many times you're going into a room. One, to preserve PPE, but two, just to reduce exposure. So looking after that and trying to find new and different ways or improved ways of communicating with them so they don't feel lonely and isolated behind a closed door.
Is that one of the hardest parts of all of this for you, saying, sorry, no one you love can come and be with you?
Yeah, and it is unusual. I think we all would like to be with our family members when they're sick and feeling vulnerable. We normally encourage patients' families in when they're sick and encourage them to be there and be a support. So having a different environment, something new that we're having to adapt to.
Have you been there when a patient has been discharged?
We've sent some people off back to hotels in quarantine, and there's often big waves down the corridor as they're walking out. It is encouraging. This is something that we're not used to. It's different to normal conditions, so it uplifts the workforce when we do get patients going home. I think when you see your nursing team come together like we have, we're a great support for each other. They're an amazing team. Before COVID-19, I think what we've really seen is some standout efforts from nurses going the extra mile, really looking out for each other and looking out for other, for themselves and other people. That's probably the standout of seeing how our nursing team's really coming together.
A lot of Australians might think, oh yeah, we've been saying thank you to health workers and they're probably busy and it doesn't make much of a difference, but you think it really does help get you through the day.
Yeah, absolutely. You see people clapping on the streets for healthcare workers, and that's something that we've not seen before, and that is an amazing thing. But I think equally we realise that we're in a lucky position because we do have our jobs and we have job security at the moment in a world that is changing for people. So we are grateful that people are acknowledging our efforts in this time, but certainly also feel very lucky for where we work.
Hello, I'm Sarah Abo. Thanks for watching. To keep up with the latest from 60 Minutes Australia, make sure you subscribe to our channel. You can also download the 9Now app for full episodes and other exclusive 60 Minutes content.